Would you like to know how to not become diabetic and do it in the easiest way, which is with diet, with exercise, with supplements, with paying attention to your sleep? If so, please stay tuned. So, I have some really good information on insulin resistance. And what we know is that nearly 1/3 of the adult population in the United States is either diabetic or insulin resistant. And unfortunately, over 90% of those people have no idea they are insulin resistant or possibly even diabetic. What we also know is that by the year 2050, nearly half of the population is going to be either diabetic or pre-diabetic. Tragic, absolutely tragic from a healthcare standpoint, absolutely tragic from the debilitation that comes about from being diabetic. And what we also know is that you can be insulin resistant for 15 to 20 years before you actually become diabetic. And too many people believe that nothing wrong happens until you become diabetic, and that couldn't be farther from the truth. There is all kinds of damage to the system during insulin resistance building up to the actual diabetic diagnosis. What that means, and there's quite a bit of science to this blog, and I'm going to try really hard to not overwhelm, but I'm also going to make sure that we have, I'm going to say, an outline of this blog available on our website. So anyone who would want to get more information, or if there's something that's not as understandable as could be, maybe it will be from on our outline. So during the time of insulin resistance, you can have a lot of microvascular damage, and what happens as a result of microvascular damage is going to be damage to organs, neurodegeneration, loss of vision, cardiovascular and cerebrovascular, your arterial system within your body and your arterial system within the brain. Can be significant, and we certainly know now that that microvascular damage cumulatively puts people at a much higher risk for dementia and Alzheimer's. So obviously we're talking about a very significant debilitation with just being insulin resistant. So here we go. Study number 1 was a study of vitamin D3. And they gave subjects who were insulin resistant and whose blood sugars were below 13. And that is an incredibly low blood sugar. Ideally, you would want to be somewhere between 40 and 60. They supplemented D3 50,000 international units per week, which ends up being about 7,000 units per day. Do not do this on your own. Please, 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 if you're to do any kind of supplementation, do it with the advice of your physician. So, with no other changes in diet, in exercise, in any of those things, 50,000 units per week, the average insulin, and I misspoke, I said blood sugar, but the average insulin went from 13 to 36. That is spectacular. Again, average is 40 to 60, and so you're approaching average. And that is massive to ward off insulin resistance and certainly diabetes. But what was also noteworthy in this study is that cognitive function improved. So not only was insulin affected, but cognitive function with purely taking vitamin D3. And the caveat to D3 is that you need to take vitamin D3 with K2. K2 helps D3 be absorbed and be useful from a strengthening of your bones, and certainly from a improvement of what essentially this is doing is it's decreasing arterial inflammation. So a marvelous, marvelous study about supplementation exclusively. Please speak with your physician before you do something that severe. Study number 2, also with D3. This one with only 1,000 international units per day. D3 with K2. Make sure there's K2 in there. 1,000 units per day is wimpy. It's absolutely wimpy. And with this, they found that blood glucose improved, that beta cell function in the pancreas improved, the cells that make insulin, that it's called COC, which is a blood measurement for absorption of vitamin D3, and that body mass improved. So 1,000 international units of D3 and all of these other metrics improved. That one's very doable. The next one has to do with the gut biome and probiotics. And the gut biome is established very, very early, around age 2. The gut biome is very much affected by environment and what we eat and what we do, and not so much about genetics. And there's a really good study about identical twins having very different gut biomes, which is interesting in and of itself. With 1 billion live culture units of lactobacillus and bifidobacillus, which is a very, very, very small amount of probiotic. Many probiotics are 30 billion, 50 billion, 85 billion. With just 1 billion units of probiotic, a very generic probiotic, greatly improved insulin resistance. It also improved blood glucose and fasting glucose. And what they also found, a spectacular study about gestational diabetes, women who get diabetes during pregnancy, responded very, very well to a very small amount of probiotic during their pregnancy, which is obviously very, very safe for their child. So probiotics are good. Talk to your doctor. The next study has to do with sleep and sleep apnea. This particular study, they were measuring sleep apnea at 5 episodes per hour. That is incredibly small. Most sleep doctors do not treat sleep apnea at 5 arousals per hour, someone who wakes themselves up 5 times per hour. However, there is still significant damage that occurs to the cardiovascular system and to insulin resistance as a result of just 5 interruptions per hour. Obstructive sleep apnea causes inflammation. It causes arterial inflammation. It causes inflammation in the system. And most physicians don't treat this until it gets to 15 and sometimes even 30. What's considered mild is 15 and 30 is moderate sleep apnea. And what's amazing to me about that is not only is that just terrifically damaging to your body, but also those people are zombies. They're not getting a deep restful sleep. So it's very, very important to perform a sleep study. It's so easy to do. Speak with your doctor about that one also. This one treated sleep apnea with a CPAP. And with the CPAP, insulin resistance improved, blood pressure improved, inflammation in the body improved. So fantastic study at very, very mild sleep apnea. The next study had to do with exercise improving insulin resistance. And what they did find is that the best form of exercise is high intensity interval training. Not everyone can do that. It is a very quickly gets your heart rate up very high. You got to be in very good shape to do that. But what they did find is that any sort of exercise improves insulin resistance. The best combo is resistance training, which has to do with weights. It doesn't mean bench pressing your body weight or bench pressing the max. Dumbbells. If you have dumbbells and you're working your muscles, then you're doing resistance training, which is very good from a bone density standpoint too. And combine that with some aerobic exercise. It can be a brisk walk, it can be jogging, it could be biking, it could be a stationary bike, anything that you're doing that you're getting your heart rate up and you're breathing a little bit heavy, you're doing yourself a world of favor. Those two things greatly lowered insulin resistance. Next one has to do with another supplement, curcumin. We know curcumin is marvelous, and turmeric is marvelous from anti-inflammation standpoint. What we do also know is that it's hard to absorb. That's very poorly absorbed and distributed into the body. But it's incredibly safe. And so it's safe up to 12 grams, 12,000 milligrams per day. Don't take that much, okay? But this study was a study of 90 milligrams twice a day. So a very small amount of curcumin improved tau and beta amyloids in the brain. And these are the plaques that build up and are responsible for dementia and Alzheimer's. Good thing. It also improved memory retention and helped out in a big way from an insulin resistance standpoint. Couple that with fish oil, with omega-3, and it improves cholesterol, it improves the ratio between high and low density cholesterol, and many other benefits by adding the omega-3 too. What was the best, their recommendation was 500 milligrams twice a day of curcumin. Go to a health food store, find a good formulation of curcumin, and that would be a marvelous one to take. Talk to your doctor. The next study had to do with intermittent fasting. That's a big one. There's a lot of buzz right now about intermittent fasting. There's a number of different ways you can do that. The most notable one is the 16 hours of fasting and the 8 hours of eating. And so most people will not eat until about noon and eat until 6 or 7 or 8 o'clock, then stop eating again, sleep through the night, you wake up, you don't eat breakfast. And there's lots of health benefits to doing the intermittent fasting. You can also do a 12 on and 12 off, which is a very wimpy form of intermittent fasting where you don't eat for 12 hours and then you eat for 12 hours. And then there's another one that's actually kind of unique, and I think this one would be a little bit harder, but you eat normally for 5 days a week, and then for 2 days a week you eat only 400 to 600 calories per day. That is a pretty restrictive amount of calories. Not everybody can do that, but a pretty good benefit to doing that one. I think the 16-8 is probably the one that works out best. And if you do that, if you have weight to lose, you're going to lose weight. If you don't, you're not going to lose weight, but you're going to have the other health benefits. Improvement in blood sugars, improvement of glucose metabolism, heart rate variability, insulin resistance, resting heart rate, blood pressure, and high sensitivity CRP, which is the blood test that we do to measure for inflammation in the body. So a fantastic way, once again, without medications, to greatly improve not only insulin resistance, but all of those other things. I threw a lot at you, and I apologize, but I was so moved by this study. And I will say that this is from Bale and Doneen, who are a very cardiovascular conscious, improving cardiovascular disease with diet, exercise, lifestyle, and those kind of things. And so this came from Amy Doneen, and they're spectacular. So what's best? Obviously, if you can do this with diet, if you can do it with exercise, if you can do it by improving your sleep, and then also another one was in there about mindfulness that I didn't share with you, but some prayer or meditation or something where you find some time to breathe deep and relax and bring your blood pressure down and all those other things is incredibly beneficial. But all of these things are non-medication, and so it's a great way to be more conscious of your body, of inflammation within the system, and certainly insulin resistance. And with so many people, a third to now even approaching a half of the adult population being insulin resistant, paying attention to these things is going to go a long ways to keep you happier and healthier for a lifetime. So why don't we hear about these more? I don't know. It's hard to say because not all of these are earth-shattering, but seeing them collectively, it's amazing what we can do. What's it take? Does it take a physician to write a prescription to eat properly and to exercise and to mindfulness and paying attention to your sleep? Does that make it more likely for someone to follow through with it? Maybe. But it's here, and those are studies. Those are very, very proven scientific studies to say that those things work. So once again, what we're trying to do is make sure that your lifestyle matches your health style. We want you to live a long time, but we want you to be healthy in that long time that you're living too, and not be sickly or worse. So Once again, this information is going to be available on the website. It might take a day or two, forgive me, but it will be available on the website for anyone who wants that. And there will be an outline that gives you kind of what we talked about. Where I can, I'm going to throw in numbers from a supplement standpoint. But please, please, please do this in conjunction with your physician. Don't go rogue and don't go crazy on doing too much of anything. A little bit of everything is a great way to stay out of trouble. So once again, Scott Proctor from Healthy Life Dentistry. I hope you find this valuable. Till we meet again.